You mentioned that you're 20 weeks pregnant and having some weird pains. You're wondering exactly what they are. And there's a few different things to think about, especially if you're preterm and having issues with pain. One of the possibilities is round ligament pain. Your uterus isn't just hanging out in your belly, it's attached to different parts by ligaments, and one of the ligaments is called the round ligament. It's attached at about the level of the belly button on the side of the abdomen, and then down attaches on the other end to the pubic bone. And so it kind of runs on a pregnant woman's belly from the sides in. And it's kind of like an elastic, and if you pull it and stretch it and then tweak it, you can see how that would cause pain. And so if you get out of the car quickly, if you stand up from the couch, if you get out of the bed for the 5th time in the middle of the night to go pee, or if you stand up off the floor, any abrupt movement can cause you to have some sharp pain on one side or the other in your lower abdomen, kind of running where that ligament runs on the side of your abdomen down into the pubic area. So if you experience that and it's sharp pain on one side, it usually goes as quickly as it comes, then it's probably round ligament pain. Sometimes it can be a little bit achy and you just kind of feel like you want to rub it for a second. Maybe it's duller and lasts a little bit longer. That is a possibility too with round ligament pain. But one of the concerns is always, is it a contraction and is anything to be worried about? And my motto is always, when in doubt, get checked out. There's really no way to tell for sure unless you talk with your doctor or go to the hospital and see a nurse who can perform an exam and decide if there's anything going on that warrants further investigation. But generally speaking, contractions feel like constant lower abdominal cramping, constant lower backache if you're preterm, or it can be pain in your lower abdomen cramping that comes and goes, a lower back ache that comes and goes. You may also experience abdominal tightening and pressure, and sometimes shooting pains down your thighs. So those are the main ways that people describe contractions. If you ever feel any of those symptoms, or you have leaking of fluid, bleeding, or an increase in vaginal discharge, those are all reasons to get checked out. Now, you did mention one other thing. When you urinate, you kind of feel a lot of pressure afterwards, and that's normal because the bladder sits below the uterus, and when you have to go to the bathroom and it gets full, it pushes the uterus up a little bit. But then when you urinate, the uterus contracts back down, and so you feel tightening and pressure. You have a little contraction, and that's very normal. As long as it only lasts for a few seconds and it's only associated with urination and you're not having regular or intense pains during the rest of the day, then it's nothing to worry about. But if you're ever concerned, like I said earlier, don't hesitate to ask your doctor, and they can help you decide if it's something to be concerned about or not. If you have any other questions for me in the future, feel free to ask them on our Facebook page at facebook.com/InnerMountainMoms, and recommend us to your friends and family too.